And welcome once again to Living in the 21st Century. Joining me today is Dr. Alok Sharma, MS, MCH, Neurosurgery, Director of Neurogen Brain and Spine Institute, and Professor of Neurosurgery and Head Department, LTMG Hospital, and LTM Medical College in Sion, Mumbai, India. We also have Dr. Nadini Gokalashandran, MD, Deputy Director, Consultant, Regenerative Medicine, Head Medical Services, Neurogen Brain and Spine Institute in India. We also have Mercy Magori Karshari, profession of molecular biologist. She's also affiliation stay-at-home mom, reversing my son's autism. And from Kansas City, right here at home, is Dr. Francis Carano, Director of Cell Therapy R&D in Kansas City. Doctors, Mercy, it's a pleasure to have you on Living in the 21st Century this morning. And our topic today is dealing with autism and stem cell research. But first, Mercy, I want to ask you a question because you are the mother of three triplets who are autistic at this point. Could you just tell us a little bit about what this is like, coping with this and finding the relevant treatment through doctors?
Thank you, Errol. I'm very grateful that you're able to come and bring this discussion to the public. So my journey with my sons has been very tough, very difficult, starting with the diagnosis, because from around 9 months, I could tell that there's something wrong with my sons, but I tried to seek the solution. What is the problem? Across many hospitals, across many doctors, but the answer I got was always that they have delayed milestones because of being premature, being boys, and being triplets. So the journey itself to diagnosis was very, very tough, and I had this internal turmoil because of the struggle as a mother who does not have the skill to be able to tell what is the problem with my sons. Then after that, there was the diagnosis, which again was just given in 5 minutes in a very brutal manner, and that actually devastated me very much. And after that, now the road to finding the right path for healing my sons.
Okay. Dr. Nadimi and Dr. Sharma and Dr. Francis, would you briefly just describe a little bit to the public who you are and what you do as a doctor in stem cell research?
So I'm Dr. Alok Sharma. I'm actually a neurosurgeon. That's a brain and spine surgeon. I'm professor at the university hospital, and we have our own hospital. Very early on in my career, I realized the limitations of conventional surgery and standard medicines in healing damage caused to the nervous system. And I realized that the hope was not in surgical intervention or drugs, but in a cellular repair of the damage. And, so very early on, we started doing fundamental research, initially with animals in tissue culture. And since 2008, we've actually, shifted our work to clinical work. So I have a very special interest in regenerative medicine, also called cellular therapy, or the use of stem cells in treating incurable neurological conditions. Dr. Nandini.
I'm Dr. Nandini Gopalchandran. My background is I'm an MBBS, a medical person with post-graduation in medical microbiology, and I found my calling first in research on developmental neurobiology. I studied how brain develops using stem cells as a tool, and eventually the calling was to get to use this tool for the purpose of repair. So I joined Dr. Sharma about 12 years back to get into this field of healing with stem cells, with cellular therapy, those who are ailing with incurable neurological disorders. So currently I am the Deputy Director of Neurogen Brain and Spine Institute, where Dr. Sharma is the director, and together we do take care of children and adults with various neurological disorders such as autism and cerebral palsy from various parts of the world.
Great. And Dr. Francis?
Yeah, thank you, Ira, for giving us this opportunity again to come here this morning. My name is Dr. Francis Carano, and as you said, I'm the Director for Cell Therapies at Lacada. Lacada is a biotech company located in Kansas City, Missouri. My work in stem cells is focused on curing diabetes at the moment. But as we are going to hear maybe a little later from Dr. Alok, stem cells are a cure for many types of diseases, and there are many different types of stem cells. So what I'm doing at this point in time is working with what we call pluripotent stem cells to differentiate them into beta cells that create insulin so that they can be used in therapies to replace damaged beta cells in diabetic patients. So that's what I'm doing, and we'll probably discuss a little more in details later. Thank you.
Great. Okay, so we're going to get really started into stem cell research as a whole. And either one of you, briefly explain to the public at large what really is stem cells and how it is beneficial in many different areas. In a layman's term, the public, they are not as elite in this field of autism and stem cells, and it's not an everyday topic. So just briefly, either one of you to go into this and give some detailed information.
Yeah, I'd be happy to. Sure.
I'll go ahead and then I'll hand it over to Dr. Alok because I know he's an expert on the autism and stem cells. Yeah. So stem cells are very unique in the body, and stem cells have two main characteristics. Stem cells can create more stem cells, or they can differentiate, become something else. So all the tissues in your body started initially as a stem cell. We have two classes of stem cells. We have what we call the pluripotent stem cells, which are more primitive, and we have what we call the adult stem cells. And I know Dr. Alok is going to address that in a little more depth. So there are all types of diseases that can be cured by stem cells. In fact, most of the chronic and degenerative conditions in the body can be cured with stem cells. And there are very, very many clinical trials mandated by the FDA at this point in time, where stem cells are being used or being tested to cure very many diseases. So how do they work? Stem cells can do one or two things. They can either replace tissue that is damaged, so you can have replacement therapy, or you can have supportive therapy, whereby they help the damaged tissues to either regenerate on themselves or repair themselves. So those are the main ways that they help cure the body. The other thing I just want to mention is that we know that stem cells, when they are transplanted into a patient, they are foreign to that patient. So the body will act by trying to reject those stem cells, just like you can get rejection in a kidney or a heart transplant. Yes. So there are various things that can be done to try to mitigate rejection. And one of them is by using the patient's own stem cells. That's called the autologous stem cells therapy. So you're using your own cells to cure your own body. The other cells that can be used are allogeneic, and that's across within the same species, but across different individuals. So one human cells can be used in another human. And to do this, a lot of times you have to come in with mitigation by using immunosuppression agents to try to help the body to tolerate those cells. Other newer issues, and I know you have probably heard the story of a person that received a pig heart recently that just died a couple of days ago. That's called a xenogenic transplant. That's what caused the species. So there are many types of transplants that can be done, but the most effective one is autologous, because then you don't have to do immunosuppression. I think that's in brief. I would introduce stem cells, and I would like to hand it over to Dr. Alok.
Dr. Alok.
explained everything very well. I'll just reinforce what you said. How are stem cells different from other cells in our body? And as you said very rightly, a stem cell, when it divides, it divides into another stem cell, but it can also differentiate into other cell types. And it is this property, the property where the stem cell can become any other cell of the body, that helps in its purpose of repair of damaged tissue. But in addition to that, stem cells also, through what is called the cytokine effects, release certain positive chemicals. They are called growth factors. And these growth factors also have a significant positive healing effect on damaged tissue. Likewise, they improve the blood supply to the damaged area through a process called angiogenesis. And as was already explained, they can repopulate, or they can actually support the damaged tissue. So cellular therapy is different from a drug. A drug, you give a drug, it has a finite action, right? It acts and then its action is over. Whereas when stem cells are given, they don't remain stem cells, they convert into other kind of stem cells, and then they go and repopulate the area, and then they repair the damage. So it's an ongoing, it's an organic process. That's the difference between a drug and cellular therapy.
So Dr. Alok, let me ask you a question. What future lies ahead for autistic kids who may be going through this mental imbalance? Do you see stem cell playing an integral role in trying to restore or bring about a change in their lives?
Absolutely. So one of the first things that we've done in our institute is we have studied the brains of children with autism using special imaging technology. One of them is referred to as a PET CT scan, positive imaging tomography, and MRI, which is magnetic resonance imaging, and EEG. So using PET, MRI, and EEG, we've actually defined and published in scientific literature exactly which parts of the brain are malfunctioning or functioning less than normal. And we have published this in a scientific paper in the World Journal of Nuclear Medicine. Now, you'll be surprised that despite the fact that autism is such a common disorder, 1 out of every 50 children has autism, and yet this work had not been done before. Now, having identified that there is a part of the brain that's functioning subnormally, we now have treated more than 3,500 children using cellular therapy. And we have shown not only clinical improvements, but when we repeat the PET CT scan, we've actually shown that the area which was not functioning before has got activated and it is functioning. So we have, in over 3,500 children, shown clinical improvement, and we have shown objective improvement on PET CT scans. And all this work of ours is published in peer-reviewed journals. So I am convinced that the future of children with autism lies in cellular therapy. Because up to now, what we are doing, if a child today is diagnosed as being on the spectrum, parents are told, and Mercy is going to talk more about that nothing can be done. You only have to take rehabilitation. That's what you're told. All right. And then when they take rehabilitation, they are taking rehabilitation on a brain that's damaged, on a brain that's not functioning properly. This would be exactly like if you had a fracture of your leg, and without it being fixed by the orthopedic surgeon, you did physiotherapy on a broken leg. Now, if you do physiotherapy on a broken leg, you can never get adequate, satisfactory results. And what we are doing now is we are treating our children of autism. We are subjecting them to an aggressive rehabilitation program, expecting a brain that's not functioning optimally to be able to do it. It cannot, which is why, despite all the rehabilitation, Children with autism still do not get back their speech. They still have repetitive behavior. They still have a whole lot of hyperactivity and several other behavioral and social issues. What we have found in more than 3,500 children is that once the brain damage is repaired, the same rehabilitation that they were doing earlier gives much, much better results, because now we are doing rehabilitation on a repaired brain. We are now doing rehabilitation on a brain that's functioning as close to normal as is possible. So I am completely convinced, based on our clinical experience, based on our scientific publication, we have the world's first scientific publication showing the safety and efficacy of stem cells in autism was published by us. And then after that, we have 16 other papers. We have chapters in medical textbooks. So I am completely convinced that this is the future of the treatment of autism. Earlier, it was being done only in Asian countries, India and China. But now we have clinical trials going on at the Duke University in the United States, and there are several other hospitals that are actually looking at using stem cells for the treatment of autism.
I will probably jump here and ask Mercy. You talked about the diagnosis, and so when the diagnosis was done, what kind of interventions did you seek for your children before realizing that they can get help through stem cell treatment? So can you tell us how that journey was?
Thank you, Dr. Karanu. So first of all, I want to talk also about diagnosis, which is a major problem in Kenya and Africa as a whole, because there is no standard, the right standard procedure, right, using the right tool. So I am in a doctor's office, and in 5 minutes, he looks at my children and he says, oh, this one is in his own world. This one is a little bit better, and they have autism. That is the nature of diagnosis, just looking and saying autism. Then after that, what does the doctor recommend? We were given a sheet of paper with diet. Don't eat this, take camel milk, avoid this. The avoiding was so much, I was even afraid about the nutritional value of my children. And then the other advice we were given is take them to school so that they can learn to interact with the others. That's the nature of advice that is available.
Yeah, and how did you handle that in your own family, and how did you come to think that stem cells can help you?
Oh, Dr. Karanu, that was just a very terrible time. The whole family has to organize how we will get camel milk, and it has to be shipped from around 250 kilometers to Nairobi. It's also very expensive. Here are 3 children, so we did it like for 6 months. We tried that approach of the diet, but it did not really yield any tangible results. But I think for me, after going through depression and clinical depression, attempting suicide, then one time I decided, okay, as a research scientist, what can I do? I went to Google Scholar, and I was actually searching for healing autism, in Google Scholar, now looking for referred articles. And before I even met the team of Neurogen, when my sons were still less than 3 years, I already knew about stem cell. I saw Panama, I saw 2 others, and I remember writing to them and begging them if they can give my sons for free, because we cannot afford. So before even meeting Neurogen as a research scientist, I already came across stem cell, and it's what gave me a ray of hope and made me to start recovering from my depression, because definitely it's scientifically right. It makes sense. It's not a guesswork. You can see how the recovery medication is coming up. And then about 5 years later is when I came across Neurogen through the chairperson of Differently Talented Society of Kenya, which is a society for parents of children with autism, who invited the Neurogen for a public discussion.
Okay. And so how did you get to meet the Neurogen team? And Dr. Nadini, you can probably chime in here and tell us how your efforts and Mercy came together to make this possible.
Neurogen has a history of about 13 years, and as a part of our outreach program of creating awareness about autism, we do workshops in different parts of India as all over the world. So as Mercy said, our team was invited to Nairobi. Dr. Sharma was there for a discussion with the parents of autism, and that's where Mercy met Dr. Sharma and saw the discussion, the seminar, where we talked about our results about stem cell therapy, how autism can be helped with children not only with autism but other neurodevelopmental disorders can be helped with stem cell using their own stem cells. So we do not need cells from outside. We can use the child's own stem cells. It is their own investment in their own bone marrow which can be used to heal their brains. So Mercy, as a biotech person, was inspired by that idea and by what Dr. Sharma said, and the rest is history, as we say. I remember when Mercy came to India with all the 3 children, we were wondering how did she come with 3 children. It was so difficult. Children were very hyperactive, running around, and we see beautiful, it's just they are different children now altogether. And I think Mercy would be better place to tell how that just happened.
Dr. Nadini, one question I want to ask you. What are some of the early signs a parent should be looking for in their kids who may have autism? And at what age do you recommend is best suitable for treatment? Or is there no age in specific?
Yeah. So the earliest sign, in fact, many parents are now very alert, and very, very early itself, some of these signs that the child is not giving eye contact, sometimes social smile is delayed, is not responding to, like other children, to external stimulus. As early as 18 months to 2 years, you can definitely pick up that something is not all right with your child. So the child likes to play alone, and now with a lot of screen time, especially in COVID, we are seeing extreme increase in the number of children with autism, regression in what they were able to do. So I think when they go for a checkup for a vaccination, that's a time that they could ask the pediatrician if there is a problem and check out their child. So as early as 18 months to 2 years, you should be able to pick up that child is different from others, and that's a time to find your pediatrician, find someone to help you diagnose the child. So earlier you diagnose, better the results. Early intervention helps not only through therapy but also stem cell treatment helps the child to recover faster. And in fact, the study which Dr. Sharma mentioned about the PET scan using, we use the PET scan to study the brain, we found that as time goes by, there is a difference in the brain of a child with autism as compared to a neurotypical child, and the child with autism goes away from a neurotypical child in terms of brain development also. So with time, the brain starts becoming worse if not intervened in time. So earlier the better, but yes, even later the child can be treated, but the best results are before 5 years. So if you catch the problem early, you start rehabilitation, and of course stem cell therapy works as a foundation for the child's brain development, which has implications much later also.
So
go ahead. Sorry, go ahead, Dr. Francis.
Yeah,
sure, go ahead.
So, Mas, I know your boys are probably identical triplets, and I know Dr. Alok said autism is a spectrum. Have you seen differences in how each of the kids present in their along this spectrum? And maybe Dr. Alok can chime in there. Why would you say, are there other environmental cues that empowered whatever is genetic on that disease? Or what is the situation there?
Yeah, so my 3 sons, despite being triplets, despite sharing nearly similar genetics, the same parents, the same environment, the same treatment, they are very different. So Ricky, there is a time they were all nearly the same traits: hyperactive, running, not sitting down, not smiling, not looking. But as the years went by, we were able to start seeing the separation of the three children. So Ricky, you could see, was a little bit mild, followed by Eric, and Lenny was more severe. So before even we had the more detailed diagnosis to place the children, even from home as parents, we could actually tell that Ricky is better than Eric, and Lenny is the one who presented with the most challenging behaviors. And this has continued even in terms of healing. We've done, we just did the fourth stem cell, and all the children across board are all making progress. So their score for autism is coming down to the normal side. The clinical presentation also is improving, but Ricky has made the most gain after the first stem cell. He developed speech completely. As we have gone with the more stem cells, his understanding and comprehension and social interaction has improved. Eric, also his speech expressive language has started to manifest, but Lenny still, he does not have even a single word. Actually, he doesn't have a voice, except now after the first time, now you ask him to repeat something and occasionally he can say something. So there is that difference, but overall, all the children are making progress.
Right. And doctors, we're going to come right back in the second half. We're going to finish off with Dr. Alok chiming in on this, and then we'll go right into the PowerPoint and